Mimi nakuanga na virusi ya HIV.
Wakati nilijua hiyo story, ni wakati nilikuwa na mimba ya mtoto wangu second born.
Lakini wote wawili ni negative. Hata tukiwa pamoja huwezi sema ati ni mtu ako positive na mwingine negative.
My parent passed on when I was very young, in class 2. I didn't know what really was happening because I was around 7 years old. The moment I was told I'm HIV positive, I asked the nurse who was talking to me, I asked her, how comes? I've never done those immoral things. I've never been sexually involved with somebody. What is happening? Now they had to explain there is this transmission of mother to child. The next thing I saw was death. I didn't see future. I didn't see as if I'm going to be where I am today. I saw the end of me.
In 2013, our prevalence for HIV was at 3.7%. Out of every 100 people, close to 4 were HIV positive in Laikipia County.
Kenya has a lower ratio of healthcare workers to population, and so our intervention to increase the number of healthcare providers has supported this, but it just shows it remains a challenge that we do not have enough healthcare workers to serve the population.
Prior to 2012, we had a problem with our CCC. It had leaking roofs. The waiting bay had not been constructed, and that affected because so many patients were fearing to come into the CCC.
Drug management was a challenge before this program came on board. We had problems with storage, transport to some of our satellite sites. We do not want to disrupt treatment of a patient who is already on HIV drugs. So continuous supply and also accessibility of those drugs to the patients, it's very important.
Without the records, we will not be able to know whether we are on the right track.
There were no shelves. Drugs used to expire very fast because they were used to be kept on the floor.
Back then, we used to have a small room where we used to see all our clients. At one point, I also got TB.
Many facilities did not have HIV services in their plan, even when they were designed. So, for instance, you'll find that maybe, TB clinics are a little corner somewhere. HIV services did not have anything. And really, you really have to work on improving the environment for service delivery.
TEGEMEZA Project is a project funded by the US government through Centers for Disease Control and Prevention, which is CDC. So CHS was an applicant in 2011. We took the theme of sustainability and initiating some sustainable approaches and innovations in the programming for the project.
The focus is to implement and expand high-quality HIV prevention, care and treatment services in central Kenya, previously Central Province, but now in 5 counties.
CHS has supported more Laikipians to live positively, has assisted more Laikipians who are HIV positive to access care, to access the right drugs, has assisted children who could have gotten the virus from their mothers not to get the virus. So that eventually is contributing to what we call as quality and better healthcare for our people.
We've been able even to see very good virus suppression rates as a result of the quality of care that we've been providing through their support.
The infections of infants that previously we started from all the way from 5.2 and now we are approximately at 2.8.
They provided support of training.
As a county, we've been able to observe the staffs that have been handed over from CHS upon completion of their contracts.
We have also provided them with tools to manage data. So sometimes we provided them with registers, data capture tools. We provided computers to many of these facilities, and this helps us to actually be able to track, the performance of a patient, look at what the data about these patients is telling us where we need to improve and others.
CHS has been very key in supporting us with the commodities.
They have provided us with some equipment so that we are able to test even the CD4s, the gene experts, the AFBs and viral loads.
Lakini kwa sasa venye CHS walikuja wakatujengea nyumba, the rooms are good, kuna privacy and the flow of clients imekuja juu.
When this program came, we were supported with storage. One of our store was renovated.
We have done infrastructure investments that are sustainable because they remain in these health facilities.
We have seen CHS grow from a small organization now to a very big organization, and we do recognize their role in HIV control. Of course, at a national level, CHS partners with us in HIV programming at the technical level. CHS is a key member of the different technical working groups at the national level and hosted here at NASCO.
CHS is the one that helped us most as far as the county AIDS strategic plan is concerned.
It's through the generous support of the American people for their continued support and funding to ensure that we can achieve the objectives of the TEGEMEZA project.
Thank you for the work that they have done.
CHS ni usaidizi wangu.
I'm very grateful and thank you for what you've done for us, the youths and the adolescents.
Tungeiwaombea Mungu wakae hapa kwetu tupate shindano ya kupona, kwa kuwa walilete watoto wetu wana na sisi tunaye. Hivyo walifanya ya mtoto ikapatikana, hata sisi tunaomba watuletee. Mungu awabariki zaidi, awape uerevu wapate ya kuponya.